welcome. You're joining us on the New Indian Express. I am Anusha Ravi Sood and with me is my colleague Chetna Belegere. She has been tracking the developments related to coronavirus COVID-19, not just in Karnataka but across the country. Here we bring to you the day's updates as on 6:45 p.m. on Thursday. There has been another casualty reported from Punjab. However, Karnataka may have something positive to offer. As we understand from the Medical Education Minister's press conference, 2 people who were detected positive for coronavirus have been treated, have recovered and are completely ready to go back home. Let me go across to Chetna to get a few more details about it. This is good news at a time when we are panicking, at a time when people are panic shopping, at a time when people are worried about a lot of things. This comes definitely as some hope and some good news.
Definitely, because as TNI had reported about the status of their health, we had said that there might be good news soon and people might be good to go. So like that, patient number 2, that is the wife of the techie who had confirmed positive for COVID-19. She is ready to go, and then there's patient number 5 who had come back from Mumbai, from Greece, and then he had come here. So those 2 are ready to go. The tests have come negative and they will be discharged tomorrow. However, they will be under home quarantine for the next 14 days. So that is very important. Though they have tested negative, they'll still be kept in observation and they will be tracking. And Sudhakar also, Minister, said that there might be some more good news tomorrow. So that, which means that there is some more hope and more people might be good to go tomorrow.
Well, that is definitely one step forward in the scenario that we are currently in. Karnataka government is also considering roping in private players in terms of bringing together test kits. There are more people going into the hospitals, going to doctors, demanding that they be tested for coronavirus. Now the government is looking at roping in private players, but that comes with a set of restrictions. And Chetna, what are the kind of permissions that the government will require, and what are the companies that the government is looking at?
Again, a kind of good news, because this is something which is very important. Though ICMR did the random samples and there was this testing done and it turned negative, the report said that it's
no community transmission
but
yet.
Still, there is a lot of doubts about whether we have shortage of kits, what is happening, and definitely I think this was the right time to rope in the private players. And according to Medical Education Minister, he is saying that Biocon, IISc, Manipal again, which was recently into controversy, but then they have also come for this, and there are several others who have come forward. But the thing is, now they need a permission from ICMR itself and also permission from NIV, that is National Institute of Virology. So these 2 permissions have to be granted. There has been a talk with the Central Health Minister and the ICMR also. So that should be coming in any time soon. So that's a good news again, where we get some private players also to get in, and these are all very highly qualified labs, which means that the testing will also be done, and they are planning to test the next category. Right now what is happening is the category A, where they have symptoms. So category B is like where you have high BP, diabetes, those kind of travelers. So even they can be tested, and also they will go to category C. So those all the categories will then be tested. So this will help definitely to ensure that we don't spread it to the community.
Yeah, definitely, yes. Also, let's remember, according to the patient tracker that we have written today, that Chetna put together, there are patients who have been tested positive for COVID but have shown no symptoms. Yeah. That means even if you are asymptomatic, you could be a potential carrier. If you have come from abroad, if you are living with somebody who's come from abroad, if you have a friend or a kin who's just traveled from one of these infected places, please compel yourself to impose self-quarantine. As of now, social distancing is key. The government is doing everything it can in its capacity to try and prevent community transmission of this virus, but there's only that much that the government can do in a country like ours with this huge population. In Karnataka, one more case of COVID positive was reported today from Kodagu, taking the total tally to 15. As of now, the health minister in Karnataka has a request. This person, patient number 15, is said to have travelled in a state government bus on 15th of March at about 11:35 in the night. Some 33 people who travelled in the same bus bought the ticket on the spot. The government, the minister, is now appealing to people that if they are one of those 33 people who travelled in this bus number KA19F3170, if you or someone you know travelled in this bus to Madikeri, please inform your local health officials at the earliest. That is of key importance
They are the
right
ones
now.
who have not done the register. I mean, they have not reserved the seat, so they
Yes.
don't know the
So the
details
government
of-
does not
Yeah.
know who these 33 passengers are. If you do know, please do come forward with information. As of now, people are in a more. We've seen that there are instances of people going berserk shopping.
Yeah.
That there have been instances of online shopping websites going out of stock or do not have a delivery slot at the nearest. What seems to be the scenario now? Because from what we understand, officially the government has not said there is going to be any emergency situation or any emergency clampdown or shutdowns.
Yes. Yes.
So,
but there is a lot of grocery stocking up happening, and then many stores have reported there is no dal, there is no dal available, there is no rice available. So those essentials, they're all panicking and buying. So we are not sure right now. There is no announcement as such, even
Yes.
about the vegetables or fruits or nothing of that sort has been announced so far. Even in the evening, press conference, there was nothing said about this.
so there is no need to panic right now. We are good to go. There are people who are recovering. There are people who are proactively coming forward, giving information about people that they find symptomatic in their surroundings. As of now, one more lab that was supposed to be set up in Kalburgi. Let's remember, Kalburgi has registered the second highest number of cases in Karnataka. The MP from Kalburgi, Mr. Umesh Jadhav, had assured that in a matter of 2 days, that's about by yesterday, a testing facility should have been set up in Kalburgi. But as of now, we understand it will take just 2 more days at least. The reagents have arrived from Delhi. However, the setting up process and the testing process to begin will take 2 more days, but that's one step forward in Kalburgi as well. The government at large in India has banned arrival of international passenger flights to the country. In Bangalore per se, the Archdiocese of Bengaluru has put a temporary ban till 31st of March on all masses, all retreats, all kinds of congregations or conventions for the faithfuls. Yesterday, we saw that the Waqf board had put out an advisory asking the faithfuls to finish their prayers within 20 minutes. A lot of temples are also shutting their doors out of voluntarily, out of concern for public health. The Chief Minister also came out yesterday, put out a public message requesting people to just follow instructions coming from the Public Health Department. Please wash your hands as often as possible. Do not touch your face, your eyes or nose as and when possible. Do practice social distancing. Please be proactive. Please take the initiative of self-quarantine. Now, before we end this particular update, I want to go across to Chetna because the government today held a meeting of its task force. What was the meeting about? What was the outcome of it?
See, they formed a high-level technical committee which involves about 8 people in it, and then they're all mostly from RGICD, and you have RGUHS, and most of the hospitals with medical colleges, they have been appointed to take make sure that everything is safe there. And then we have 2 helplines launched. I'll just tell out the number: 46548600 and 6669200. These 2 are the extra helplines other than the ones which already exist, which have been
104 is the health helpline in Karnataka. There are volunteers working round the clock. The government has opened up its doors to take in volunteers who can, regular common citizens like you and me, to come and work with the government. There are volunteers coordinating with government staff at every district and taluk level headquarters to bring you the latest updates, to keep you informed. We at Express will try our best from our end to bring you the latest events. In case you have queries to be made to the government, if you have any doubts, if you come across a message that you're not too sure if it's real or if it's fake, do write to us. We are on all social media pages. We are on Twitter, we are on YouTube, we are on Facebook. Do write to us. If there are queries, do post, and we on our end will try very, very diligently to bring you the answers. Do stay tuned with Express as we bring you the latest updates. Thank you.